On January 14th of 2019, I suffered a major stroke. Fortunately, my wife called 911 quickly enough to get an emergency team, and they brought me to St. Joe's Carondelet. I became a patient at the Neuro Institute, and I couldn't be more pleased with the results.
In early 2006, my partner, Dr. Robert Goldfarb, and I presented a plan and requirements to meet the needs of some of the more complex types of care that our patients required. And by 2009, we were ready for our grand opening. The commitment we had was to bring together the technology, the people, the training, the staff, to bring a higher standard of care for neurological patients in the community.
The east side of Tucson really needed a neurological institute. Before we opened, we had to ship patients to Phoenix, to Barrows, to any larger facility. Even having the university hospital here, we were missing that neurological care. And since we have opened, not only do we get patients all from southern Arizona, but from New Mexico and other states as well. So it's a hub for neurological care. We were one of the first.
I think we're able to provide not just care for the local community around St. Joseph's. We are able to support all of the other stroke centers here in Tucson, and we also support 8 rural hospitals all the way to the border in southeastern Arizona. It's the idea that it's a stroke community, and we provide care to all stroke patients.
We've been at the cutting edge of everything as far as patient in surgery to post-operative care, and in addition to the navigation services. Everything that we've done has put us a little bit ahead of the curve in being the trend for how these patients should be cared for.
During my time as a nurse at St. Joe's, I've seen lives change. I have seen patients who I thought had no chance of recovery have incredible stroke survival.
Seeing a patient, especially coming through the ER and having a significant injury, whether they can't speak or move, and you give them a life-saving medication, it just brings tears to my eyes even to this day.
What we do up here is amazing work, and it's pretty awesome to be a part of that.
In the last decade, we've seen great changes in the economics of healthcare, and the Institute has adapted to be able to continue to offer the best care we can in a rapidly changing environment.
It's been everything and more than I would expect in a I would say a top-notch operation. Every person that I've interacted with at St. Joe's, whether it's been a doctor or a nurse or people involved in the rehabilitation program, has treated me with respect and obviously has a degree of expertise that's necessary to help people who have suffered a stroke or perhaps other neurological injuries. I wouldn't be here today without them. So I'm very pleased to have been brought to St. Joe's.